Hi, I'm Monica Scott, and today we are examining factors contributing to suicidal ideation. Erskine and Toller's research showed adolescence can be a time of increased likelihood of suicidal ideation. However, there are certain factors that increase that likelihood of suicidal ideation even more. For example, the research of Fulganiti and colleagues found that minority stress in teens is an additional factor of this phenomenon. My research looked at those factors contributing to suicidal ideation in youth and included age, sex, race, rape, being bullied, substance abuse, sexual orientation, and lack of community support. The methods that were used in this study are as follows. The 2021 Youth Risk Behavior Survey was used. This survey is conducted biannually by the Center for Disease Control, and the 2021 survey included 30,261 high school students with an average age between 15 and 16. Of those, 54.5% were male, 54.7% were white, 13.8% African American, 5.1% Asian, and 26.4% were of other races. The variables in the study were dependent variables, suicide ideation, and independent variables, feeling of belonging, which respondents had the 5-point scale of strongly disagree, disagree, not sure, agree, and strongly agree. For race, they had the option of white, black, Asian, and other. For age, it was 13 and under, then 14, 15, 16, 17, and 18. Sex, they were able to choose female and male. And having been bullied was electronically or at school with the yes or no answer. And having been raped, also yes or no. And then substance abuse was either no lifetime use at all or at least one of 7 drugs used in a lifetime. And sexual orientation was recorded to just heterosexual or non-heterosexual. In this bivariate correlations table, you can see that age was the only variable that did not have a significant correlation with suicidal ideation in youth. In this logistic regression table, the Cox and Snell and Nagelkirk-Yartuz values show that between 14.1% to 26.9% of the variation in youth experiencing suicidal ideation can be explained by the independent variables, with race being the only variable that did not have a significant relationship with suicidal ideation in youth. This lets us conclude that for every 1 year increase in age, the odds of having suicidal ideation decreases by 7.6%. Males are 24.3% less likely to have suicidal ideation compared to females. Being bullied increases the odds for suicidal ideation by 96.5% and being electronically bullied by 67%. Feelings of belonging decreases the odds of suicidal ideation by 22.5%. And rape increases the odds of suicidal ideation by a whopping 198.8%. Substance abuse increases the odds of suicidal ideation by 184.1%. And for those individuals who are non-heterosexuals, the odds of suicidal ideation increases by 260.7%. After looking at the study, there are several policy implementations that I would suggest. First, young adolescents need extra support. especially females, as well as rape victims, non-heterosexuals, and those who do not feel a sense of belonging in school. One policy that could be implemented that may affect all of these areas is parent education. Letting them know how important these early years of adolescence are and how much difference parental support can make. Teaching them how to listen to their adolescents and knowing when to seek help for adolescents should be taught. There also could be a policy implemented in school in which maybe a counselor could see each student at least once a month, regardless of need. Not every adolescent would readily seek out counseling, and making this a monthly thing, those who are not inclined to talk about certain subjects might start talking about those subjects, and the counselor could touch on sensitive subjects that the adolescent might not otherwise be inclined to talk about, like being raped. Lastly, there are not enough support centers, nor enough substance abuse centers for individuals, nor is there enough information on how to get help on substance abuse issues. Policies could be implemented to build more treatment centers and possibly make schooling for counseling on substance abuse more affordable, and educate school counselors as well as teachers on how to support someone they suspect of using drugs. Also, students could be taught on how to go about asking for help when they need it. And this concludes my presentation.